You've just seen a video of some specialists and a GP describing how clear roles in a shared care approach to cancer survivorship and care plans can promote good survivorship outcomes. A survivor also describes her positive experience of a shared care approach. This chapter has been developed to highlight new ideas and changes that could be made within a GP service to improve patients' survivorship outcomes. Cancer survivorship spans from the moment of cancer diagnosis and for the remainder of a person's life. Mostly, survivorship needs are addressed at the end of treatment, but survivorship care should be introduced from diagnosis. It includes traditional medical follow-up regimes, but in recent times there has been a shift towards a patient-centred approach that looks to screen and manage unmet needs in cancer survivors. The optimal care pathways are national guides that outline the best cancer care for specific types of cancers. There are guides made specifically for patients that explain what to expect before, during, and after their cancer treatment and tells them about the care that they should be offered. What to expect guides have been developed for 19 different cancer types. Carers, family, and the community might also find this information helpful. They are also available in 8 different languages. With advances in technology and cancer treatment, survival rates for all cancers have improved over time. In Australia, relative 5-year survival rates for all cancers have increased from 41% in the mid-1980s to 68% in the 2010s. In Australia, recent statistics show 5-year relative survival rate for melanoma is 91%. Within this day and age in Australia, we have an ageing population. Regarding cancer survivorship, this means that there are more survivors in the community. There is an increase in new cancer diagnosis due to more people living longer. There is an increase in cancer survivors with comorbid conditions. And there is an increase in supportive care related needs for this growing population group. At least 50% of cancer survivors experience some late effects of cancer treatment. Evidence shows cancer survivors who have completed treatment experience a range of unmet needs. With growing numbers of survivors and demands on an already stretched cancer workforce, survivorship care plans are emerging as one element in an improved and more coordinated approach to survivorship care. Survivorship care plans promote multidisciplinary care and are a communication tool used between the treating team, the patient, and the GP. These plans aim to provide a consistent, coordinated management plan and flow of information to help ensure good survivorship outcomes. Care plans may be developed in hospitals involving multidisciplinary team members such as oncologists, psychologists, cancer nurses or social workers, or can be developed as part of a GP chronic health care management plan, combined with team care arrangements if required for referral to allied health providers. The Institute of Medicine suggests the plan should include information about the type of cancer the patient had and the type of treatments they received, or a treatment summary. The short-term and long-term effects of treatment, what to be alert for, and how frequently to visit the doctor for checkups and screening. For melanoma survivorship, this would involve skin check surveillance, checking lymph nodes, wound healing and scarring. It also involves assessing psychosocial effects such as mood, including the possible fear of cancer reoccurrence. Surveillance may change over time based on the staging and the patient's preferences. Educating patients on self-skin examinations would also be addressed in this section. The survivorship care plan should also encompass the screening and management of non-cancerous conditions such as cardiovascular disease, diabetes, and other comorbidities. The care plan should also address how the survivor's follow-up care will be coordinated between the oncology specialist, GP, nurse specialist, and who to contact between follow-up appointments. For more invasive melanoma cases, the lead clinician should provide regular treatment summaries and pathways for re-entry into the hospital system if needed. Lifestyle changes should also be addressed in the plan. Many changes in lifestyle have been proven effective in reducing the risk and severity of treatment side effects, preventing comorbid conditions, and promoting better health. Lifestyle information includes advice about healthy diet, smoking cessation, alcohol consumption, obesity and being overweight, regular exercise, and sun protection. Finally, the plan should also address other useful community services and resources relevant to people affected by cancer. We Can is a new Australian supportive care website to help people manage the day-to-day impact of living with cancer and survivorship. The site provides easy access to many excellent resources, services, and information developed by other organisations who specialise in cancer and community support. Support groups offer the opportunity for those affected by cancer to meet others affected to discuss and share concerns, information and ideas in an emotionally supportive environment. Connecting with the survivor through services such as the Cancer Connect or Melanoma Patients Australia may be helpful. These links can all be found on the We Can website. To guide you in the process of developing a survivorship care plan, templates can be downloaded from the Australian Cancer Survivorship Centre website. The Australian Cancer Survivorship Centre works with health professionals, survivors, community organisations and policymakers to improve outcomes for survivors. Although they don't provide clinical services, the Australian Cancer Survivorship Centre has a comprehensive hub of resources tailored for both health professionals and patients and carers. Their hub connects survivors and those close to them with information and where to access support services.